welcome to our show, Health and Wellness Myths and Facts. Hormones are integral to our body systems and they regulate a lot of what our body does. Hormones are powerful. It takes only a tiny amount to cause big changes in cells or even the whole body. That is why too much or too little of a certain hormone can have serious effects. Men and women are quite different when it comes to hormones, and however, hormonal imbalance is more common in women than in men. Women's reproductive health, fertility and menopause often involves the topic of hormones, and when female hormonal imbalance becomes an issue, the consequences can manifest themselves throughout the body, taking a toll on a woman's health and quality of life. There are some conditions that can be prevented by modifying one's lifestyle. Hormonal disorders can generally be managed well with proper medicines as well as treatment. We have an expert panel of endocrinologists who will provide accurate as well as actionable advice to prevent the development of hormonal disorders and guide our viewers towards effective long-term management strategies as well. So, let's welcome our panel, our doctors. We have Dr. Ipshita Mishra, Assistant Professor at the Department of Endocrinology, SCB Medical College from Cuttack. We also have Dr. Emmy Grewal, Associate Director of Endocrinology as well as Diabetes from Max Super Speciality Hospital in Mohali, and Dr. Hema Singh, Consultant in HOD, Department of Endocrinology, Metro MAS. This is the hospital in Jaipur. Thank you so much for joining us here on NDTV. My first question is for Dr. Mishra. Hormones affect the quality of life of both men and women. How do hormones affect women's health is my first question. Dr. Ipshita.
Thank you, Divya, for the question. Well, you have already given a very brief introduction about how hormones play an integral part in the survival of human life. Now, when we talk of hormones, the multitude of hormones in both the sexes, male and female, they are almost similar, but some hormones need special mention for a female, especially the reproductive hormones, of which we call as the sex steroids, thyroid hormones, and something called as prolactin. Now, these hormones, they influence the most important health of a woman, that is the reproductive health, right from the onset of the menopause, the menarche, and everything is influenced by these hormones, including the fertility issues. Apart from this, one of the most important health factor for women is the bone health, which is very neglected, and these hormones, they influence a lot to take care of the bone health of women, and definitely to some extent about the metabolic and the cardiac health.
Right. Thank you so much for providing us with that information. My second question is for Dr. Grewal. Doctor, women are more likely to develop hormonal imbalance disorders than men. Why is it so, and what are the steps that women can take to minimize the risk of hormonal disorder? Dr. Emmy Grewal.
Yeah, if we see that most of the hormones, like in the females and males, are similar, it is only the sex hormones that are different. So what happens in the male, it's higher testosterone levels, and in the females, it is estrogen and progesterone, which is on the higher side. So this high estrogen sometimes can lead to autoimmune diseases. These are the diseases in which the body attacks its own cells. So that leads to the dysfunction. For example, thyroid disorders, hypo as well as hyperthyroidism is much more common in females. Then second reason is that in the females, that during the various phases of life, for example, in puberty, in menopause and in pregnancy, there is wide fluctuations in the hormone levels. So that leads to increased incidence of hormone imbalance. For example, like in pregnancy, there is more of hypothyroidism. In PCOD and in puberty, and also in the menopause, there is rapid decline in the hormone level. So that leads to abnormal fat deposition. We know that estrogen causes less of abdominal fat deposition. So in the menopause, they have more abdominal fat deposition that leads to obesity, diabetes, and other hormonal imbalances. And also because rapid fall in the hormones leads to osteoporosis. So for in any case, as we already said, that lifestyle modification is very important. Healthy diet with a balanced calcium and protein and good amount of exercise. And also very important is that patients should have regular checkups so that any of these diseases can be caught at the earliest and treated well.
Right, doctor. A very crucial point there to keep getting oneself checked in order to know if everything is okay or not. Now, my next question is for Dr. Singh. What are some of the common disorders affecting the female reproductive system? Dr. Hema Singh.
So the female reproductive system is actually very delicate. Even little changes in hormones can lead to many problems. So when we discuss the reproductive problems, let's just divide them age-wise. So if we talk about the young girls, the most common problems which we are facing nowadays are the girls are getting early pubertal changes, then some have delayed puberty, and once the menarche sets in, there are certain menstrual irregularities, which may be either excess menses or there are scanty menses or delayed periods, which most commonly are due to PCOS, hypothyroidism. Sometimes the females have ovarian cyst. Now, when we go to the fertile females, there may be problems of infertility. As age advances, the females deal with lower abdominal pain due to pelvic infections. Then there may be uterine fibroids, which may again lead to abdominal pains or sometimes abnormal menses. Then you turn to slightly older age, people may have problems related to menopause like hot flashes, vaginal dryness, itching. This is also the age for gynecological malignancies which are also hormone related like breast cancer, ovarian, uterine, cervical cancers. And in all the sexually active females, there are problems related to sexually transmitted diseases, the HIV being one among them. Besides, there may be also some chronic pelvic pains which may affect the young girls as well as the elderly females, which is sometimes due to endometriosis, which is again a hormone related problem which can be easily dealt with medications and sometimes may require surgical correction.
Right, doctor, you just mentioned menopause. That takes me to my next question. Menopause marks the end of the childbearing phase of a woman's life that began with puberty. What hormonal changes takes place during that phase of menopause? Dr. Ipshita Mishra, if you could answer that.
Okay, now first we should know what menopause is. Now menopause is usually it is physiological and it is defined as when there is a cessation of menses for 12 consecutive months after you have ruled out all the pathological causes. So usually the age of onset of menopause in Indian females is something around 45 to 50 years. So what happens is when the menopause sets in, the most important is the sex hormones, that is estrogen and progesterone, which comes out from the ovaries, that stops coming out. So the functioning of the ovaries is declined and these sex hormones are not available for the normal body. So when a woman is deprived of these sex hormones, some of the women they adjust to it, some of the women they do not adjust to it, and the most common problem which they face is the climacteric symptoms or the vasomotor symptoms, which includes your night sweats, hot flushes, vaginal dryness, dyspareunia. So all these group of symptoms they set in. So apart from that, there is also problem with the cognition part. Some women face cognitive problems, mood disorders, and then the cardiovascular health, as Amy ma'am has already told, that the metabolic and the cardiac part starts getting involved and you get a spectrum of the cardiovascular metabolic disorders in the postmenopausal woman. So apart from this, one most important is the bone health issues also set in. So osteoporosis, the pathogenesis of osteoporosis is rather aggravated when menopause sets in.
Right, doctor, thank you so much. Knowing the symptoms can also help to manage that in a better way. Are there any specific symptoms as far as menopause is concerned that one experiences? Let me take this question to Dr. Emi Agrawal.
Yeah, as Dr. Ipsita said, that menopause happens, or we say that lady has achieved menopause when it's 12 months past the menopause. But as the hormone levels decline even preceding that, so the patients can have these menopausal symptoms even prior to that. It can be even months and years prior to the menopause. So the patient should be aware of these symptoms, and also they should be aware that these can occur prior to once the periods stop. The patient might be having regular periods at that time. So one of the most symptoms are non-specific, but one of the commonest symptoms that is seen is flushing. So what happens is here the lady has sudden onset of heat-like sensation in the upper part of the body, in the face. It may be associated with excessive sweating. So that they might have some dizziness also. The problem with this symptom is that they can last for a few seconds to minutes and can be very frequent sometimes. So that can lead to the disturbance in the daily activity and daily routine. And if in night it happens, they can have night sweats, disturbed sleep that leads to increased fatigue, tiredness, joint pains, and all these symptoms. Then second group of symptoms may be because of the mood disorder. Again, these are very non-specific, like anxiety because of the menopausal symptoms, or the patient may end up with a depression, or the patient may have other psychological issues related to the menopause. Then thirdly, because of decline in the hormone, these patients may have vaginal dryness. This is one of the specific symptoms may be related to the menopause. They may also manifest with recurrent vaginal infection and recurrent urinary tract infection. If the patient has knowledge about these symptoms that it may be because of menopause, so treatment of these symptoms like vaginal dryness with local creams will sometimes heal even the urinary tract infection. So it is very important that patient has the knowledge of these symptoms. Otherwise, patients may be running to the various specialities like cardiologist for increased heart rate, which may be associated with the menopause, or psychiatrist. But the basic cause may remain undetected and untreated.
Right, doctor, you did mention hot flashes. That is very common as far as menopause is concerned. What can a woman do to prevent and minimize the incidence of hot flashes? If I can take this question to Dr. Hema Singh.
So, when ma'am has talked about hot flashes, definitely it affects the quality of life of the patients, and the severity may vary from mild symptoms to very severe dreadful symptoms, which may land up you in the OPD of a cardiologist. So before we move on to medication, it's very important that we try to do certain changes in our lifestyle. First and most important is to eat healthy diet full of fruits, vegetables, have a proper night's sleep, avoid spicy food, avoid alcohol, smoking. This is not only going to improve your hot flashes but otherwise overall health also. It's very important to maintain an ideal body weight. It has been found that obese females, they have more frequent and more severe hot flashes. Then you can try certain mild relaxation techniques like meditations and yoga. Keep the temperature of the room slightly on the lower side, and you can just keep less clothes during night time, since most of the flashes usually occur at night in most of the females. Now if these lifestyle changes are not working, we do have certain medications. So you can go for non-hormonal medications like certain SSRIs and antidepressants, which are quite helpful in many patients of mild to moderate symptoms. But in case the symptoms are not relieved with this, patients can also choose to get hormone replacement therapies. So these can be in the form of tablets or vaginal creams, gels, pessaries. They not only reduce your hot flashes but also help in removing the vaginal dryness, itching, and it's also good for maintaining the bone health. But they do have certain complications in certain selected group of patients related to cardiovascular disease, blood clotting, slightly increased risk of breast cancers. So this has to be chosen very correctly by the patients and the doctors before prescribing.
Right, doctor, thank you so much for telling us about how we can minimize those hot flashes situations during the menopause phase, and lifestyle changes are key. With that, we're stepping into a very short break. We'll get you a whole lot more on our show, Health and Wellness, Myths and Facts, on the other side. Welcome back. You're watching Health and Wellness, Myths and Facts. We have Dr. Mishra, Dr. Grewal and Dr. Singh with us. Let me take my next question to Dr. Mishra. Undergoing a hysterectomy, that is the surgery to remove all or part of the uterus, can raise many health concerns. Can a hysterectomy cause menopause? Dr. Ipshita Mishra.
Okay, right. Now, menopause, mostly it is physiological, normal. When around 45 years, the functioning of the ovaries, the decline and the sex steroids production goes down. But what happens in surgical menopause, if the uterus is removed with both the ovaries, then there is a sudden decrement in the production of the sex steroids. So, but if the uterus is removed with sparing either a single or both the ovaries, so you have different modalities of surgery, then the issues in terms of manifestations of the symptoms of menopause are not great because the ovaries still produce the sex steroids. But if both the ovaries are removed, then definitely that when there is a sudden decrement in the levels of the sex steroids, there are always sheer chances that the woman feels the deprivation of these hormones suddenly quite markedly. So because in a natural physiological menopause, there is something called as a menopausal transition period. So 3 to 4 years prior to the onset of the full menopause, the body starts gradually adjusting to the lower levels of the sex steroids. But when suddenly it is decreased by a surgical procedure, then the marked symptoms in terms of the climacteric symptoms such as hot flashes and night sweats, they are relatively more in those women where a surgical menopause occurs, in certain group of a woman having surgical menopause.
Right. Thank you so much, Doctor. My next question is, can hormone therapy help treat and manage the symptoms of menopause? Dr. Grewal.
Yeah, definitely. As we have discussed earlier, that these menopausal symptoms can sometimes be very distressing. As we have already discussed the lifestyle modification, after the lifestyle and dietary modification, if the patient has severe intractable flushing or night sweats, in those cases we have to start the hormone therapy. Then other condition where it will help is in the case of mood disturbances, and also if the patient has excessive vaginal dryness or if there is decrease in the sex drive. With the long-term effect of these hormones will also be that these hormones will improve the bone density, or rather prevent the decline in the bone density. So we know that the post-menopausal period, the patients start having decrease in the bone density, so they end up with the fractures. What we say is osteoporosis. So that also will be prevented, though this is not primarily the treatment for osteoporosis. So any patient who has intractable symptoms of menopause, primarily flushing or night sweat, mood changes, vaginal dryness, hormonal therapy is definitely going to help. So these actually are the normal estrogen and progesterone which are given to the patient. If the patient has hysterectomy, in that case, only estrogens are enough. As we have already discussed, the patients can be on oral tablets. The better form are patches and gels. And if it is only just the local symptoms like vaginal irritation, dryness, in those cases, the local creams as well as the tablets will also help. These days, there is so much of concern about the side effect, but most of the patient, if well chosen, and they have baseline better investigations, in those cases, many of these patients can be started safely on the hormone therapy. Some patients like who had previous history of breast cancer or uterine or ovarian cancer, or who had uncontrolled hypertension, who has history of having blood clots, those patients should not be started on the hormone replacement therapy. And it has been seen that if the patients are started on the therapy prior to 10 years after the onset of menopause, they do not have much side effect, but the side effects are much more if the patients are of older age or have passed more than 10 years after the menopause. Yeah.
Right, Doctor, you did mention some of the complications. What are the main health complications that can occur with menopause? Can we prevent these health complications? Dr. Hema Singh.
See, estrogen hormone, the basic female hormone, doesn't only have reproductive functions, but it do have important functions in maintaining the overall health for female. So talking about menopause, there is a reduction in estrogen hormone. That is why there is affection of the cardiovascular system. So your cholesterol levels may increase, your risk of having a heart attack may increase. So this is the ideal time, that is the perimenopausal period, where you may meet your physician, just check your blood pressure, check your lipids and blood sugars, because these may be additional risk factors for your cardiac diseases, besides maintaining a good and healthy lifestyle. Now, when menopause occurs, in the first 5 years, there's a rapid fall in the bone mass, which leads to a condition of brittle bones called osteoporosis. And this osteoporosis, there is increased risk of fractures, especially your spine, your wrist and your hip. So perimenopausal and postmenopausal females, they are at increased risk of fractures. So it's very important you take a healthy protein rich diet with good amount of calcium, and if your diet doesn't contain good amount of calcium, maybe you can take some calcium vitamin D supplements so that your bones are healthy. Menopause can also lead to urinary incontinence in some females since the pelvic muscles becomes lax. So it's a good thing to practice your pelvic muscle strengthening exercises, and in some cases the hormonal replacement therapy also helps in this incontinence. Then as Dr. Grewal has rightly said, there is increased vaginal dryness which may sometimes lead to recurrent urinary tract infections also. Certain females, they actually experience weight gain. They come with a problem of weight gain following menopause, and this is basically because your metabolic rate slows down. So it's very important that at this time we cut down slight calories, start exercising and maintain our body weight so that we are actually spared from the other metabolic diseases like diabetes, dyslipidemias and cardiac diseases which may follow following menopause.
Thank you, Doctor, for that answer, and also thanking Dr. M.E. Garewal, Dr. Hema Singh, Dr. Ipshita Mishra for joining us here on NDTV on our special show, Health and Wellness Myths and Facts. Thank you so much for watching.